Welcome to Looking at Lids, the next frontier for medical aesthetics. This promotional learning program is sponsored by RVL Pharmaceuticals, Inc. and is not certified for CE/CME credit. Information presented in this program about RVL products is consistent with the relevant FDA-approved labeling and/or directions for use. This presentation is only intended for healthcare practitioners who practice in specialties for which on-label use of the products is appropriate. As we all know, the eyes are the focal point of the face. However, they're also one of the first areas to show signs of aging. The eyelid skin is about the thinnest on the body and is prone to stretching, which may lead to droopy or tired-looking eyes. These changes, small or large, can make people feel old and even impact how others view them. People who suffer from asymmetry also might feel dissatisfied with their overall appearance. As a healthcare provider trying to optimize the patient's aesthetic journey, it's important to evaluate and assess periorbital changes. There are countless treatments offered for facial rejuvenation, with many occurring on the upper third of the face. Aesthetic providers know how to soften wrinkles to the forehead and how to address volume and symmetry around the face. But what about the eyelids? As you can see in the photo, eyelids have been underserved and often unrecognized in aesthetics. Acquired ptosis, also known as low-lying lids, occurs when the thin muscles that elevate the upper eyelid become weak or stretched. This can create an appearance of an arched brow or a higher lid crease. Acquired ptosis can affect adults of all ages, is historically overlooked, and may become severe enough to impact superior visual field. There are two main muscles in the eyelid that are responsible for lifting. The levator muscle, which opens the eye, is a voluntary muscle and lifts the lid about 14 millimeters. The Mueller's muscle is a smooth muscle that cannot be controlled and needs to be stimulated to lift the eyelid. As you can see in this image, the levator muscle fibers go into the skin, and that's how the lid crease forms. When the muscle stretches and pulls back, the lid crease gets higher because the fibers are higher up into the skin. So a higher lid crease is a sign of ptosis. So, what is the magnitude of the unmet need? An online survey of over 2,200 female aesthetic patients between the ages of 20 and 70 years old who had previously had neuromodulator treatments, fillers, peels, and/or microneedling was conducted. Survey respondents were shown images of 4 different eyelid positions and asked about their self-perception of their own eyelids. The survey found that 64% of the respondents believe they have low-lying lids, and 59% of these women said they are bothered by the appearance and/or droopiness of their eyelids. This demonstrates the importance of incorporating a proactive conversation with patients about their eyelids into a full facial assessment. Low-lying eyelids are a common concern for aesthetic patients and are easily identified if you know what to look for. Here are 3 quick steps to conduct a lid assessment that should only take you a few seconds. In picture 1, can you see her full iris, the colored part of the eye? Or does the lid margin hang below the upper edge of the iris? In picture 2, can you see that her eyelids are uneven or how one eye appears smaller than the other? Finally, in picture 3, do you notice the gap between her lash line and the upper eyelid crease, and that there is a more distinct upper lid platform showing? These are things you should start looking for, and keep in mind that low-lying lids may affect one or both eyes in adults of all ages and can contribute to an asymmetrical appearance. Like anything else in medicine, you should also consider the potential for a more serious condition. Signs to look for include new onset of unilateral ptosis, especially with pain, unequal pupils, double vision that resolves when one eye is closed, and/or lack of mobility in one or both eyes. If an eye is turned outwards, they might have a third nerve palsy. These are neurological issues that are more emergent, and while uncommon, you should always refer these patients to an ophthalmic specialist. Let's look at how you would assess a patient. Usually, the upper lid should be about a millimeter just above the limbus, which is the slightly darker ring between the cornea and the sclera, the whites of the eye. So the question is, can you see the full iris? Not on this patient. Are the lids symmetric? Maybe just a little bit asymmetric. Do they have a high lid platform? They do. More of the upper eyelid is showing. So, this patient has ptosis. Let's go through another example. Can you see the full iris? No, the lids are maybe a little bit lower than the previous patient. Are they symmetric? Not really. There's a little more upper eyelid showing on the left eye. It's subtle. Do they have a lid platform? There's more of a higher lid platform. So once again, this patient has ptosis. So, what is Upneeq? It's oxymetazoline hydrochloride ophthalmic solution 0.1% and is the first and only FDA-approved pharmacological treatment for low-lying lids in adults. Upneeq delivers a rapid, visible lift to the upper eyelid for adult patients with acquired ptosis. The dosage and administration is 1 drop administered topically to one or both ptotic eyes once daily. It's important to remember that ptosis can affect a person's visual field. While low-lying lids do not affect every patient's vision, it is something to consider. In clinical trials, Upneeq achieves significant visual field improvement in patients with moderate to severe low-lying lids. Some practical considerations are that Upneeq is single-use only, so to help avoid contamination, patients should not reuse vials. And for patients who wear contact lenses, they should be instructed to remove their contacts before Upneeq is used, and then reinsert their contacts 15 minutes after the application of Upneeq. But patients who wear contact lenses can use Upneeq. And if patients are using any other drops, you should instruct them to administer those drops 15 minutes before using Upneeq. Let's look at some important safety information for Upneeq. There are no contraindications, warnings, and precautions. Ptosis may be associated with neurologic or orbital diseases such as stroke and/or cerebral aneurysm, Horner syndrome, myasthenia gravis, external ophthalmoplegia, orbital infection, and orbital masses. Consideration should be given to these conditions in the presence of ptosis with decreased levator muscle function and/or other neurologic signs. Alpha-adrenergic agonists, as a class, may impact blood pressure. Advise patients with cardiovascular disease, orthostatic hypotension, and/or uncontrolled hypertension or hypotension to seek medical care if their condition worsens. Use with caution in patients with cerebral or coronary insufficiency or Sjögren syndrome. Advise patients to seek medical care if signs and symptoms of potentiation of vascular insufficiency develop. May increase the risk of angle closure glaucoma in patients with untreated narrow angle glaucoma. Advise patients to seek immediate medical care if signs and symptoms of acute narrow angle glaucoma develop. Patients should not touch the tip of the single patient use container to their eye or to any surface in order to avoid eye injury or contamination of the solution. Adverse reactions. Adverse reactions that occurred in 1 to 5% of subjects treated were punctate keratitis, conjunctival hyperemia, dry eye, blurred vision, installation site pain, eye irritation, and headache. Drug interactions. Alpha-adrenergic agonists, as a class, may impact blood pressure. Caution in using drugs such as beta blockers, antihypertensives, and/or cardiac glycosides is advised. Caution should also be exercised in patients receiving alpha-adrenergic receptor antagonists, such as in the treatment of cardiovascular disease or benign prostatic hypertrophy. Caution is advised in patients taking monoamine oxidase inhibitors, which can affect the metabolism and uptake of circulating amines. To report suspected adverse reactions or product complaints, contact RVL Pharmaceuticals at 1-877-482-3788. You may also report suspected adverse reactions to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Upneeq is a fast-acting proprietary novel formulation of oxymetazoline. Most patients in clinical trials had a lift in their eyelids in as little as 2 hours. In one study, some patients saw a lift in their eyelids as fast as 5 to 15 minutes after the first dose. The average lift seen in clinical trials was 1 millimeter. Upneeq is non-preserved and formulated with hypromellose that can help coat and protect the ocular surface. It's a once-a-day application that lasts about 6 to 8 hours. This is some of the tolerability data from the clinical trials. Vital signs and ophthalmic parameters as measured at 6 and 12 weeks were all normal. No change in heart rate or blood pressure. No change in visual acuity. No staining of the cornea. No change in intraocular pressure. Over 95% had no discomfort at the 6-week mark, and 92% had no discomfort at the 12-week mark. And there were no documented cases of tachyphylaxis over 14 to 84 days of treatment. Adverse events that happened in 1 to 5% of eyes were punctate keratitis, conjunctival hyperemia, dry eye, blurred vision, installation site pain, eye irritation, and headache. They were mostly mild and non-treatment related. Let's look at some before and after examples. Here's a patient that we assessed earlier, and you can see in this photo taken 1 hour after instilling Upneeq that the lids are lifted and give her a more rested appearance. Here's the other patient we previously assessed. Look how much tarsal show there is in the before picture. And then you can see after treating with Upneeq. If you look at the lateral white triangle of the sclera, her eyes appear to be more open and bigger. Here's another person with acquired ptosis, particularly in the left eye. You can see that 30 minutes after treatment, the white triangle on her left eye is bigger and her eyelids are more symmetrical. Here's a patient that's a little older. You can't see her full iris. Her eyes are fairly symmetric. The left eye maybe droops slightly more than the right. There's more of a high lid crease, and she had increased lid platform show. After instilling Upneeq, you can see that less of the upper eyelid platform is showing, and the patient's eyes appear less sleepy. Upneeq is a natural addition to a facial aesthetic practice and provides the opportunity to offer appropriate patients a non-surgical treatment for their low-lying lids. You'll discover that assessing eyelids only takes a quick moment. Begin by looking at the lid margin to see if the eyelid is covering some of the iris or pupil. Look for asymmetry, a higher lid crease, or arched brow. Help the patient understand that this is a common concern for many patients. Start the conversation using helpful phrases and questions like, "Many of my patients tell me their eyes look tired. Do you ever feel that way?" Or, "A lot of people notice changes in their eyelid. Have you?" Finally, consider educating patients by sharing with them that the eyelid skin is the thinnest in the body and it shows some of the earliest signs of aging. Then let them know that you have a new treatment called Upneeq that might work for them. Thank you.